from the studios of the Department of Communication in Phillipsburg, welcome to Prime Minister Talks with Honorable Prime Minister Sylvaria Jacobs.
Hello, and welcome to Season 2, Episode 2 of PM Talks. This is a program that I've dedicated to making sure the people of St. Martin are informed, not only in case of general affairs, but literally everything related to governing. And right now, as you all know, the government of St. Martin, under the leadership of Richard Planafleck, our Minister of Public Health, is working together with CPS and the Public Health Department on the rollout of the vaccine program to ensure that our population is protected from COVID-19. Minister Planafleck, welcome to Prime Minister Talks. I know this is your first time, and so a very special welcome to you. And I must say congratulations to you. I know you've been working hard, and I must say missing a lot, but for good reason, because you were working hard to ensure the people of St. Martin can be inoculated. How has it been preparing for this COVID-19 rollout of the vaccination plan?
First of all, thank you, Prime Minister, for having me in your show, PM Talks. It has been a real roller coaster. A lot of negotiations have taken place within the Kingdom partners. Prior to that, when I entered and the vaccine projects worldwide came to be not even available at that time yet, but people were starting to prepare. There were choices that had to be made. Either you go with your Caribbean PAHO members, or that you will join the Kingdom within the Kingdom purchase. And that was already something that took some time, because you not really gambling, but you're doing risk management. That word will be coming a lot forward, because everything that we do with this pandemic is basically risk management. So when the decision was taken that we will go with the Kingdom partners and the rest of the islands of the Dutch Caribbean also went along, we are basically set then with another kind of negotiation with the Netherlands then, how it will be rolling out, what will we be getting, what was the time frame. Up to last week, up to Wednesday, we had a meeting where we came to agreements that the vaccines will surely be arriving in St. Martin coming week, and that we will start then the week after with the vaccinations. Prior to that, you have the whole program naturally of making sure that the freezer, because the Pfizer that we will get first, and I'll explain why, needs to be stored in minus 80 Celsius constantly till when you reach the moment of preparing it, so that the people can be vaccinated. That will take time. It has to be in a very secure location. You need to have a whole security operations around it, from the time it arrives to location, and then when you're going to get the people will be vaccinated. One of the questions of last night's interview was, why Pfizer? You know, sometimes, and I'm really trying to continue to be nice, if we will bring Moderna, the people will ask, why we didn't get the Pfizer? Now we're getting the Pfizer. Now the people say, why we getting Moderna? If we will get Moderna, Pfizer, they will say, why we don't get Sputnik? Oh, by the way, that's the Russian one.
No, let's stick to what we have. So we're getting Pfizer.
So we're getting Pfizer, and why we're getting Pfizer first? Because it will be in stages. The research has shown that Pfizer is the best vaccine for the 60-plussers. And every vaccination have to be in 2 doses. The first one, and within a couple of weeks, the second one. As a matter of fact, Wednesday we had a discussion with our Kingdom partners of the Netherlands, because they are changing their protocol from 6 weeks between the first and the second. And we told them, no, we want to maintain the 3 weeks, seeing that we will get the dosages in time, and then we will continue. And that's what I was trying to explain to our people yesterday. We have the culture, I too, get to forget, especially if it's a prick, it's out. But anyhow, so for 3 weeks, you don't get the time to forget. By 6 weeks, you might say, is it now the fifth or so? So we try to work with our people and keep it to the third, so that will be after the third, you will have your second dosage, and then it will peak to the highest percentage of protection and building up your immune. The other thing, if I may continue once we are here, once you have your second, especially when you have the second, but from the first already, the more people get it, the immune, what they call the herd immune, will start building it up. Once you are immune, the possibility, as research is being shown so far, is very low that you might get infected. Like there was a question yesterday also that Professor Deutsch was answering, is if after the first one, because by the second one it becomes almost impossible. After the first one, you still tested positive, is because you was infected, not by the vaccine, but your body was infected, but you didn't show the symptoms yet. But by the second dosage that you will get of the vaccination, that will almost be impossible to be, that you even if you get infected, because you can't get infected, because you basically immune for 50-60%, and then the 95% will grow with the second one. So that's why we it's decided that the Pfizer will be the first batch of vaccination that we will get, both for the 60-plussers and for the healthcare professionals. Why the healthcare professionals? The healthcare professionals are those that are working with our most vulnerable in the community, and if you build that safety net within that system, also it works better for the protection of those that they are taking care of. No, it's not that nobody else is being left out, but you have to start. And as was explained yesterday also during the live streaming, that you want to start with those that are more vulnerable, let's say, in our community, and slowly but surely you're building up to those that have more resistance, that if they get it, up to now, they're getting only mild symptoms and things. But, building it from the more vulnerable to those that are the strongest among us, you will basically expand exponentially the immune system of the community, and everybody will be protected.
Wow, Minister, I thought I was a talker. I'm very, very pleased to see that you have all this information, so parat, it's just flying out of you. I mean, I followed the panel discussion yesterday. I think it was an excellent, excellent panel discussion. But of course, we have to continue to inform our people. So I'm going to ask the people of St. Martin, all tuned in, to stay with us. We're going to take a very short break, and we'll be right back with more information on COVID-19 vaccination plan for St. Martin.
Prime Minister Talks with Honorable Prime Minister Sylvaria Jacobs.
Vaccines saves approximately 2 to 3 million lives every year and are therefore one of the most effective medical intervention ever invented. A vaccine protects you, but additionally it also protects your family, friends, and vulnerable people in your community. The more people get vaccinated, the harder it will be for the virus to spread. When enough people are vaccinated to create herd immunity, it can put an end to the pandemic. The government can then scale down the coronavirus restrictions, and the tourists can return, which is vital for our economy. The COVID-19 vaccine will be free of charge for everyone. It is not mandatory to take the vaccine, but it is highly encouraged. If you have questions about your own specific situation, discuss them with your doctor. In the meantime, we must be responsible and keep practicing the COVID-19 safety measures like wearing your mask, washing hands, and maintaining social distance. This public service announcement has been brought to you by the Department of Collective Preventive Services and the Department of Communication.
Prime Minister Talks with Honorable Prime Minister Sylveria Jacobs.
Welcome back to Prime Minister Talks. We're in our second episode for 2021, and we have with us the Health Minister, Minister Richard Panafleck, who is now a professional as regards everything that has to do with our COVID-19 vaccination program. And yesterday he took part together with 2 doctors and CPS, as well as the head of the White and Yellow Cross, Brechtje Boetekes, in a wonderful panel discussion. And today we're continuing with dissemination of our information via this venue. Minister, you ended just now talking about the different cluster groups that the phases that we will be vaccinating people in. And I know a lot of questions came up on how we would be able to manage this. And I'm seeing it all over the US and UK that sometimes the management can go crazy. So I would like to encourage the people of St. Martin to register themselves and their elderly to be able to get this vaccination. So can you tell us a little bit about how the registration is being facilitated, all the different ways?
Well, thank you, Prime Minister, once again. The registration that basically yesterday at the soft start, today it's on the website www.stmartingov.org. You can register, but besides that, we realize that not everybody have in the available either internet or a laptop. So basically by their general practitioner or the pharmacies, they will be able to get the forms that they can fill in and register. Today, this morning, I encountered a gentleman and they asked me, first of all, I want to make a couple of things clear. The vaccination is for all who resides on St. Martin. Okay. Yesterday, people are telling me, yes, because residency paper, people correlate that with legals. No. Residence is everybody that lives on a territory. But let me make it more clearer. It is for those born here and from here, those are born to be here and are living here, and those that all of them that are living from Monday to Friday to Saturday for months here. So documents, non-documents, this is a health issue. This is not immigration. Maybe somebody told you, oh, he used to be director of immigration. I'm not the director of immigration. I'm right now the Minister of Health, Social Development and Labor, and as such, I'm dealing with the health pandemic, and and as I said yesterday, the information gathered will not be exchanged with no one. No one. The only ones that will use that is for the vaccination purposes, are the health professionals within the system. Other than that, don't come ask me about it, because I will not tell you. And those that are in the chain also knows that they cannot. Besides that,
confidentiality is one of the main issues, and I know based on EOC days that CPS does not share information. They do not share information. So correct. Even when we have to report on our numbers, it goes without name, without birth dates, without any data except male, female, and age, right?
Correct.
Just wanted to make sure that that was clear.
Yes. So it's not their fault, but I even put it stricter. So you ask, they'll tell me, and then I'll tell the Prime Minister. So that's one thing. For me, if you allow me just to go through the clusters briefly again, it will be the health professionals, 60-plussers. Then we will go for those between 18 and 60 with underlying conditions. Then also the essentials. The mere fact that we have 1, 2, 3, 4, it don't mean that it always 1, 2, 3. 1 and 2 is at the same time. 2, 3, and 4 together, and then you have all the others that what I expressed just now as the stronger about us, like when I used to be young also. The Pfizer, even though research has been done and it is safe for up to the age of 16, it is determined between in the kingdom that we are not vaccinated as yet, nobody under the age of 18. So it will be 18 and up. Now, I don't want to bring confusion, but for those that I was following yesterday, making their comments, why are we getting Pfizer? The Pfizer is, for now, for the 60-plussers and the health professionals. Maybe for the second phase or the third phase, they might have the Moderna or AstraZeneca. That depends what is the availability and what will be used. All of them has passed both the FDA and sometimes FDA faster as the EMA, this is the European Medical Association, credits. If they didn't pass any of those entities, they will not be available on the market to be used. And each of them, the European, the test prior that they went to these entities had about 40 to 60,000 people that they had tested already. Right now, we're talking about 22 million in Israel already that has been vaccinated. Why Israel? Because Israel have bought so much of them and it's vaccinated at a fast pace into its community. And coming to that, talking to the side effects, that means that right now, 1 in every 22 million persons have some kind of side effects like that they say is when you are allergic reaction. They have some very professional name for it, calling it, let me see, anaphylactic, but that's just allergic reaction.
Have allergic reactions. So right. If persons, I know, I had a mother, my mom was severely allergic, she would have to be careful, but she also took the flu shot when she was alive. So a lot of our elderly already take the flu shot. I think people need to remember that. Also, children every year get inoculated against DTP polio, against mumps, measles, and rubella, and even when you have to go to college. So taking vaccines is like a normal part of our life. We shouldn't be afraid of this one any more than any other that we already have taken in our lives, and really not to follow unauthorized newscasts or WhatsApp forwards that are bringing even more fear into it. There is no effort, definitely not by this government, to control anyone. It is a matter of us creating as much as possible herd immunity without people getting sick. We can get the same immunity by all of us getting sick. And then those that are healthy would recover quickly, and those that have underlying conditions have a higher chance of getting severe cases, ending up on a ventilator or dying. We want to avoid that, and that's why, Minister, I'm reiterating, we're starting with our most vulnerable persons and the persons who take care of them. But I want us to take another quick break because, you know, we're doing our 3 short segments, and when we come back, we'll get back into why it's so important that you do take the vaccine. We'll be right back.
Prime Minister Talks with Honorable Prime Minister Sylvaria Jacobs.
Les vaccins sauvent environ 2 à 3 millions de vies chaque année et constituent donc l'une des interventions médicales les plus efficaces jamais inventées. Un vaccin vous protège, mais il protège également votre famille, vos amis et les personnes vulnérables de votre communauté. Plus le nombre de personnes vaccinées est élevé, plus le virus aura de mal à se propager. Lorsqu'un nombre suffisant de personnes sont vaccinées pour créer une immunité collective, cela peut mettre fin à la pandémie. Le gouvernement pourra alors réduire les restrictions concernant le coronavirus et les touristes pourront revenir, ce qui est vital pour notre économie. Le vaccin COVID-19 sera gratuit pour tous. Il n'est pas obligatoire de se faire vacciner, mais il est fortement encouragé. Si vous avez des questions concernant votre situation particulière, parlez-en à votre médecin. En attendant, nous devons être responsables et continuer à appliquer les mesures de sécurité du COVID-19, comme le port du masque, le lavage des mains et le maintien de la distance sociale. Ce message d'intérêt public vous a été présenté par le département des services de prévention collective et le département de la communication.
Prime Minister Talks with Honorable Prime Minister Sylveria Jacobs.
Welcome back to Prime Minister Talks. We're here having a riveting conversation with our Minister of Health, vaccination specialist for St. Martin. Jokes. But anyway, I really am impressed with the amount of knowledge he has absorbed in his many, many meetings on a weekly basis with the RIVM and our health professionals, and with the plan that we've been able to put together as government of St. Martin, where it's not only just the Ministry of VSA, but the whole government that is supporting the rollout of this program. So let me just say a great big thank you to all of those persons who are involved and ensuring that we can safely roll it out. Minister, we have planned, we are now in possession of the freezers to keep the cold chain intact, so that there will be nothing going wrong whatsoever with our vaccinations once they get to the vaccination site. We have a plan in place, we have persons involved, there will be medical professionals at each location. The persons will have been trained completely in carrying out every aspect. Can you give us a little bit of information as to where the availability of the vaccine? So we know how to register, you can do it online, or you can do it at your GP or pharmacy. The next step now is, where do we go to be vaccinated?
Good. Thank you, Prime Minister. First of all, I would like also to acknowledge the vaccine manager here for Deeg that has come in Holland and has been great help to the team. Together with the team, we got so far that we are ready to receive and roll out the vaccines. After that you register, you will be receiving what they call uprooping. So they will call you or send you an app, email, or if that's not possible via the web, they will give you a phone call, and then they will tell you exact the locations. The first location that will be started is this CPS office that is by the Vineyard building. After that, when they continue rolling it out, it will be also in the Dutch Quarter Community Center, and the third one will be the Coal Bay Community Center, where they will be rolling it out. Naturally, those that are in the St. Martin home by the White and Yellow Cross will receive it there themselves. Those are the three places that are besides the White and Yellow Cross, that is for our senior citizens that are staying there or recreating there. Those are the three places that we have right now for where the people can get vaccinated. I have to say also that it is good for the people to know, because we are trying all what is necessary for them to be as comfortable as possible taking the vaccine, seeing the huge amount of misinformation, I can say that, that's out there all over. Once you go there, there is a whole procedure. They will register, they will ask you if you're feeling any sickness, if you're feeling okay, they will check that you are who you are. So naturally, again, I will stress, if you don't have a St. Martin ID or Dutch passport, just bring some kind of identification, any kind of identification that you have, so that we can know that you are who you are. After that, naturally, you will get your vaccination, and then you will be monitored for 15 minutes to make sure that you don't show no signs of side effects or nothing. There will be physicians at the locality with all other kind of healthcare professionals. If you are one of the 0.5 in 100,000 to get some allergic reaction, there will be physician, medical professional, and medicines that they can submit to you one time, and that you will surpass that uncomfortable feeling at the same place. If anything happened, and if we're so bad lucky, there will even be ambulance there to will take you to the ER. So it will all be prepared in the best interest of our people, our community, so that everything goes smoothly. There is no reason to have no alarm. And the other thing, next time when you go to the general practitioner, if there's any doubt, talk with him or her. They know your condition of health, and ask them what their opinion are.
Thank you so much, Minister. It's so important that our people of St. Martin know how hard we are working as government to ensure that everything is taken care of before we even roll out this program. We're going to ensure that we get the information out. I want to repeat that we're starting at the Vineyard Building, at the St. Martin Medical Center, and at the White and Yellow Cross, those three places, as those fall within, the easier to control. And as we become more, then we will move over to the Dutch Quarter Community Development Center, the one that's next to the doctor's office, as well as in Cold Bay, the Cold Bay Community Development Center, so that no one gets confused. Of course, you will get that notification once you have registered. So the first thing you have to do is to register. Register yourself, regardless to which group you fall in, and the department will then sift out the ones that belong in the first group, second group, etc. I think it's a very important thing. Initially, I can say I was not necessarily in favor of getting it myself because I didn't consider myself in the risk group. But when we think about taking this vaccine, it's not only about ourselves. We have to think about all those around us. And if you have elderly persons or other persons with underlying conditions that you have to deal with on a regular basis, you are risking that you can pass the disease on to them. So I'm asking you for yourself as well as for your family, and to create a community that is safe, that we can actually go back to normal. It is imperative that as many of us as possible go out and get vaccinated. So from the Prime Minister to you, register today, register as soon as possible, and encourage others to read the information. We have the fact sheet, we have the website, and we have panel discussions that you can go back and listen to, look at, send your questions in, and I'm sure that we will be able to answer them in subsequent broadcasts. Minister, any final words?
Well, once again, thank you for the opportunity through your platform to address the people about the vaccination once again. Listen, it's not mandatory, but like the Prime Minister said, and we all are saying, it is for your best interest and of your loved ones. Get vaccinated. Thank you.
This has been Prime Minister Talks. Stay tuned to subsequent broadcasts where we will continue to update you, the people of St. Martin. Until then, make sure to keep yourself safe, don't get COVID, and don't spread it to anyone you love. Have a blessed and safe weekend, St. Martin.